These are in listen-only mode.
Well, hello, and thank you for joining HIPAA Chat today with HITECH Answers and our host, Steve Spearman. Today, we're going to be talking about HIPAA breaches and fines with our guest attorney, Matt Fisher, who's kind of a semi-regular on HIPAA Chat, so we're glad to have him back again. If you're new to HIPAA Chat, hopefully you're going to like the program. This is a Q&A program where we take questions from our audience through the registration page, and also during the broadcast you can chat me a question or preferably use the question box on the right side of the dashboard. I'm Carol Flagg of HITECH Answers, a familiar voice hopefully to those of you who have been with us before. And of course, as always, HIPAA Chat is sponsored by eFax Corporate, which is a brand of J2 Cloud Services. They've got a number of award-winning products related to the secure faxing environment and exchange of PHI. So please check out their website, enterprise.efax.com. We appreciate their sponsorship. Without it, we would not be able to do HIPAA Chat each month. HIPAA Chat is now on LinkedIn. We've created a group on LinkedIn where we sort of answer additional questions, or Steve does, regarding all things related to HIPAA. So go ahead and check that out. Please join the group. The link is provided below. You can also
actually Matt, who is our, he's our first regular, right? Because this is the second time on the show.
He's our
I
first
think that means
yeah.
He's also a contributor there, so he can give you a
yes.
more legal, which is another way of saying smarter answer than I'm capable of giving. So.
And I do keep an eye on it, so when I see questions that I can respond to, I do chime in.
It's a pretty active group. It's small still, but it's growing and pretty active. We also you can find HIPAA Chat as we record these on YouTube. You check it on YouTube, and we also air HIPAA Chat on our internet radio station, healthcarenowradio.com. You can go ahead and check it out there and download podcasts of previous events. Our host, as always, is Steve Spearman. Spent a couple decades in healthcare and is a chief security consultant. He is a busy man working with clients on HIPAA really every single day, night and day. And he actually hosts his own sort of monthly webinars, which you can check out at his company website, healthsecuritysolutions.eventbrite.com. If we don't get to your question today, if you got a question between HIPAA chats, always contact him. I know for sure he is very diligent and loves to get feedback and questions from our audience. You can contact him at spearman@healthsecuritysolutions.com. As we mentioned,
hey Carol.
Yo.
Carol, before we get on to our esteemed guest, I'm going to make a shameless plug for both of us. I have started what I think is going to be kind of a weekly event-ish sort of. We're gonna start publishing a weekly Q&A on a single topic with HITECH Answers, which I'm super excited about. We've already got about 6 of them that are in the process of being completed. The first one I think is on a Q&A on file sharing. So everybody that's listening, please keep an eye out in your HITECH Answers inbox for that, what's going to be a weekly feature.
We're very excited about that.
I'm super excited about it. I think it's going to be really helpful to be able to get a nice, quick bite-sized chunk on particular topics, and so.
And no shortage in the HIPAA arena. That's
not at all.
Sure. Yeah, and getting more complex every single day. So yeah, so let's look for that in HITECH Answers. We'll also probably publish a few of them on HIEanswers.net. As we mentioned, Matt, this is a second time he's been with us in HIPAA Chat. We're going to be celebrating our 1-year anniversary in September, and so we're glad to have him back. Matt is a healthcare attorney with a focus on HIPAA, privacy, security, fraud, and abuse. He works with Merrick, O'Connell, Damali, and Luigi. Matt, let me know how that's pronounced. In Worcester, Massachusetts. I'm from Massachusetts. I'm somewhat familiar with Worcester. Matt also...
So Matt, hey Matt, is that like a 10-year-old photo or something? You look way too young to be this accomplished attorney.
I hate to say it is getting closer to being 10 years old. It's back from right when I started in 2008, so it is starting to get a
I
little
think this is
deep.
kind of false advertising. I want to see what the updated recent new Matt Fisher looks like.
I'm sure he looks the same.
See, when I started,
Probably
I was
does.
told you better like your picture because it'll be there for a very long time. And I said, that is perfect.
If you go to HITECH Answers and you search on Matt Fisher, you will see a number of blog posts about breaches and penalties and fines and all sorts of things. So please check him out. And you can follow him on Twitter at Matt_R_Fisher. And we are going to obviously dive right in and take questions from our audience. But first and foremost, the topic in general, Steve, you actually wrote a blog post about a recent HIPAA breach and fine. Matt, you've covered this as well for your law firm blog and for HITECH Answers. So I guess before we dive into questions, maybe we should talk a little bit about what's going on.
Yeah, and I'm going to actually just sort of point something out too, that it sort of has to do with an evolution of my practice and my thinking, and it's around the issue of penetration testing, which we actually had a show a few months ago about that, and it could be a year when people said, oh, do you have to do pen testing? And we actually have a Q&A going up on pen testing too in a few weeks. My answer was like, well, the rules don't explicitly require it, but it's been interesting what a difference a year makes in the industry, because a year and before that we were mostly talking about stolen laptops, but of course in the last year the big incidences, massive incidences, in fact, have all been hacking, and so that's really elevated the need for people to consider doing pen testing. We do pen testing at Health Security Solutions, but mostly it's a sincere kind of encouragement. I think it's important to consider as that part of your toolkit. As we get into this issue, I think it's an important consideration. So.
Yeah, and I'll just pick up on one thing, kind of one point that you just made there, Steve, which is, as you said, a year ago, you wouldn't have put penetration testing at the top of your list. I think the key there is that you have to continually be reevaluating the environment, because the threats and the concerns are always changing. So it really kind of touches into a lot of the aspects of HIPAA compliance. Mostly, in my mind, especially with you're talking about the penetration testing, your risk analysis, making sure that you're updating that on at least an annual basis to make sure that you're accurately capturing where your risks are. Because I agree, a lot of these things, a lot of the elements within the security rule are flagged as addressable, but the way things are going, you really have to be cognizant of what's going on, because even if it's addressable, it's almost becoming a required element with the number of issues that pop up around some of these items. So, picking up on one thing you said, unencrypted laptops or mobile devices, I know encryption is addressable, but at least in my mind, it is such a hot topic that you'd be almost foolish to some degree not to be keying in on that and trying to put it into place.
Yeah, that when a truck is backing up, that sound. It's like I'm trying to get where it's that sound, because I want to kind of put it out there, because risk analysis, which has been required for a long time, people have a positive responsibility to document the, quote, threats and vulnerabilities to the confidentiality, integrity, and availability of electronic protected health information. And you could have reasonably argued a year ago that you could do that and do it well without necessarily requiring a pen test. But and again, I'm not quite willing to go out and say, okay, if you're not doing a pen test, you're not in compliance. But it is a much more important consideration, I think, especially for enterprises. Everybody needs to be doing vulnerability assessment, regardless of size, and enterprises need to be doing, penetration testing as well. So, anyway, but yeah, as you said, the HIPAA compliance is not a static thing. It's not a once a year. It's a dynamic thing, and that's how it's written, and that's why we have to kind of stay aware of what we need to be doing. So.
Yeah, and I think it ties perfectly into our topic for today too, because you can really learn a lot by seeing what breaches are being announced, because that really keys you in on the primary issues that people are facing. Kind of going back to what Carol said about the most, I think it's the most recent one, or at least the biggest profile most recent one that was announced, which, as Carol said, both of us wrote about, which was about at St. Elizabeth, which is actually only about 40 minutes away from where I work. Highlighting the fact that you have to be cognizant of what's going on and what services are being utilized. My feeling is, it obviously arose because of improper usage of file sharing service. It's not to say that those tools aren't usable within the healthcare industry, but you have to know which ones you're using, because you have to be going with the tools that know what HIPAA is and have said that they're going to implement protections and standards that are in line with what HIPAA is expecting.
Yeah, and actually in keeping with what we've both written, because the Q&A that I think has that Q&A been published yet, Carol, or is it about to?
It's going to publish next week. So
yeah, and so that one is like it's. The technology is not in and of itself a problem, but you've got to understand, whether it's compliant, and specifically, I mean, one of the standards is the evaluation standard, which I point out. All the standards under the rules are the right way to think of them is required, even if there are implementation specifications under them that are addressable. And that's one that has no implementation specifications. It's a standard that stands on its own, and you have to kind of evaluate what are the security implications. And a lot of people love file sharing. I'm a big fan of them. I think I'd be happy if more services like that were deployed in healthcare. But you've got to do it in a manner that is consistent with the regulations. So that means Dropbox is out.
Right.
Dropbox is not compliant, and then there are others that can be used that will work.
And obviously, aside from the HIPAA compliance, which is, I know our focus today, but there's just other reasons to want to make sure you're using a secure service. I know, especially in my office, there's actually been a couple other law firms in our immediate area that have been hit with like the CryptoLocker virus or similar issues, which has made us very cognizant of wanting to make sure that everything's secure. And as an alternative to trying to make sure people aren't using the things like Dropbox or others that don't have protections, we built our own secure FTP site. So there certainly are solutions that are available and that are not going to break a budget, that can help you meet requirements, especially for those entities in healthcare where you're subject to so many regulations.
Yeah, I talked about that very option of like using FTPS or SFTP to facilitate it, and that has a number of interesting advantages that people should at least be considering. So anyway, that was an extended jumping in there. So lead us, fearless leader.
Oh my gosh, no, I'm definitely the sidekick. Yeah.
Hey, lead us, Tonto.
Lead us, Tonto. Well, all right. So let's dive right in these questions. Mine, our audience are from folks who registered, but if you have a question while we're talking, please use the question box found on the dashboard to pose a question for Steve and or Matt. First of all, Lisa would like to know, do BAs need to have a contingency plan if they don't store designated record sets of EPHI?
I'd love to hear Matt's take on this. This is actually a very interesting question. I have some thoughts, but I'd love to hear Matt. I'm pushing you off the diving board first, Matt.
Yeah, that's fine. I'm ready to take the plunge. It's hot and humid up here, so getting into the pool sounds like a good idea. But for a contingency plan, yeah, you should probably have something in place, because it's the contingency plan is not necessarily tied to if you're maintaining the designated record set. It's, my impression is that it's really applicable if you're maintaining PHI, because the contingency plan obviously is to make sure that you've got backup systems in place and that you're not going to lose the data. Obviously I know if it's the designated record set that that's probably more. There might be a little bit of a heightened concern around there because it's kind of can view it as kind of a core area, but I really do think you should have something in place. Because again, if you're thinking about the contingency plan, it's also really business continuity that is something you probably want to have in place regardless, because you're going to be looking at data recovery and maintaining operations in the event that that something occurs.
Steve?
Yeah, and good. Yes, that's kind of the direction I would have gone. The main thing is just to note that as a business associate, you are required to comply with all the security rules, and the security rules include contingency planning, and you're required by default to comply with some of the privacy regulations, because some privacy pieces are contained within the actual BAA. So, for example, accounting of disclosures and the requirement to report incidences and breaches, etc. But the main thing, though, is I think as a practical matter, when you're writing your contingency plan, it is worth actually in the plan noting the extent to which you are engaging with and touching protected health information, and so what the scope of that plan needs to be is not something that the regulations dictate. It's your actual environment, practical operating environment. And just to keep in mind too that that contingency plan, and what a lot of people really, they focus on data backup, but it's, contingency planning has to address, confidentiality, integrity, and availability altogether. But we tend to think of contingency planning as focusing on the availability component. So, I guess the point is that if it's a security rule, as a business associate, you have to comply with it. That's the right first way to think about it. But then it's also appropriate for you to actually write a contingency plan that's consistent with your operation. And I like to see that kind of specificity in the policies and procedures of the organizations I work with.
All right. Gail, everyone calls out big breaches, but obviously they get a lot of media attention like the one we're talking about today. But are there examples of smaller organizations affected by breaches that require notification?
I'll take that, and then
Oh, yeah, sure.
What I was going to say is, so I mean, first of all, that require notification is an interesting thing. If there's a breach, you have to there's a notification requirement, and I'll even maybe let Matt kind of go into kind of what that means specifically. But SOS doesn't protect you from that requirement, and I'll just sort of note that there are a lot of breaches. In fact, I mean, given that, well, let me give you an example. If you are a clinic and you misdirect mail to the wrong person and you become aware of this, that's considered a breach under the rules, and you have to actually report it under an annual reporting requirement. So being small doesn't preclude your need to comply with the breach notification requirement. And to that, I'll just add that that Matt and I, as consultants and an attorney, we are dealing all the time with small clinics and organizations that are, want some direction and help to know how to respond to a breach. And I'll say it to Matt, is if you have a breach, a breach, there's certain kinds, and Matt, maybe you can even answer this, but your attorney, an attorney like Matt, should be one of the first calls that you make, if not the first one, to help you, get direction to kind of the steps you need to take. Now, And Matt, I don't know what you think. You have this annual reporting requirement, so my misdirected mail, that could just be a log that you keep, and that I don't think that HHS really cares about that there. It's extremely common, but there's definitely kind of a threshold over which, don't be doing this on your own by any means.
Yeah, no, Steve, I agree with you there. It's, obviously, as we know, the big threshold to keep in mind is the 500 number, which is, if you have a breach impacting more than 500 people, that's the one where you're going to make the headlines. But as Steve was pointing out, regardless of the size of the breach, if it's under the 500, then annually you do have to submit a whole log of the breaches you've had to HHS, and it's going to go into a database there. So it's, no matter what size breach you have, there is going to be notification. It's just a matter of where it's going. 'Cause you always have to remember that no matter how many people are affected, all the way down to one, you always have to tell that the individual who is impacted by the breach. The size of the breach only dictates where it goes and how quickly. As we know, if you cross the 500 threshold, again, it's immediate notification to the government and also local media, and that's the one I always worry about because that's where things quickly get out of your control. But again, I also agree with Steve that it doesn't matter what size organization you are, you have to comply with the notification requirements. And I hate to have to disagree with Steve on the point of what you should do first in the event of a breach, because I would love to say that the attorney should be your first call. The first step should actually be having your robust breach notification policy in place, which will help you to start mitigating the impacts of the breach before you have to call anybody to help you out with it, because you want to be taking immediate steps as soon as you recognize a problem. But then, yes, I agree, once you recognize the problem and you're starting to let your set processes run into place, seek help so you can be able to make sure you're running through an investigation and everything appropriately. To some degree, I think part of that is you want to be able to show to anybody who then comes in after the fact that you took it seriously and you were doing everything that you need to do. Obviously, I say all this knowing the limitations of smaller organizations, which is always a concern and something that I think advisors who want to work with you will be cognizant of. I've actually worked with a small group practice that's only like 3 or 4 physicians earlier this year on a breach, and we were able to work through it pretty quickly, but they certainly needed the outside help, and part of that was just to make sure that they kept on task with doing what they're doing. And the one other thing I'll add is that for smaller organizations, I think one of the biggest causes of breaches are actions of insiders, and that's probably not really unique to small organizations, but unfortunately, I think that the smaller ones just, obviously they have good intentions, and I don't think they're meaning to do anything bad, but just don't have the time and resources necessarily to do maybe all the training and education that they need. So people might not realize that what's going on is not permitted under the HIPAA regulations and will technically constitute a breach.
Well, and I would think certainly, that hackers focus in on the very large organizations. When you hear about those sorts of breaches, in these small organizations, not so much. Kip, talking about smaller organizations, Kip's question is, do you guys know of any breaches that resulted in substantial fines but not much press because they were less than 500?
Yeah, so I'm aware of one breach where there was a fine, or an announced fine, because there was, even though there was less than 500, and that was one announced by OCR back in, I think it was 2013, affecting Hospice of North Idaho, where the reported issue was an unencrypted laptop was stolen. But then remember, once you disclose something to OCR, they will come in and then investigate you, and that's probably where you will really end up with a fine. is because whenever they come in to investigate, they're going to find an issue well beyond whatever you reported. In this case, the investigation showed that no risk analysis had occurred, and that, I think, was the driver of why OCR announced a public fine on a breach less than 500.
Steve?
Hey, Matt, is there a, yeah, I'm here. Yep, can y'all hear me?
Uh-huh.
You there?
Yep, we can hear you.
Oh, okay. Hey, so Matt, I am actually curious, given, because I understand your point, not looking at your good breach policy or incident and breach policies, but is there a threshold, if you will, over which you would say you definitely need to get in touch with an attorney? Like, is there, when is the time? And let's assume they don't have, these are organizations regardless of size, but even large, and they don't have internal counsel, they don't have, or if they do, maybe no expertise still. Is there a kind of thing that you really say you really need to always make sure to get help at this point?
I think the answer to that one really depends on the particular circumstances that you're looking at. Like I work with a hospital where I support the privacy officer there, who is a very good and knows HIPAA pretty much cold. So she'll call and bounce things off of me. Sometimes it could be something impacting one person, or it could be impacting a bunch of people. So I think it's really just, to some degree, driven by the comfort that people have. With that being said, though, I would say that if you do have a suspicion that there are a large number of individuals impacted, that's where, even if you have a very good handle on what the issues are, where it can be beneficial to get outside consultants, and especially outside counsel or any counsel involved. Because one thing that I'm always cognizant of is, once you get an attorney involved, you can start being able to cloak some of the stuff in the attorney-client privilege, which will mean it's not going to be something that anyone outside can gain access to, and it can protect some of those communications, which can allow some more frank discussion of some of the issues.
Interesting too, Matt, is, and this again, just very slightly a little off topic, but I've had at least two, and I probably could count some more, that have had hired me as a result of an action from OCR that were initiated because of an employee complaint, and usually it was after termination. And I, and I mean, my sympathies were so much with these clients, but I mean, they had to deal with the consequences. And I don't know if you have any recommendations about, I mean, other than get your house in order and actually do a good job here, but it does seem like this is an area in which there's some vulnerability to employees.
Yeah, no, I agree with you. And there are generally there are a couple steps that you can take. And I probably should have thrown this out there earlier, but obviously I think it's understood. I'm talking generally, so I can't give legal advice to anyone specifically, but some general thoughts to keep in mind are, as part of a good compliance program, generally you should have a way for people to report things either anonymously or not, and then you should document what investigation steps you've taken to look into the complaints. I know a recommendation as part of a good compliance program is to then have some type of follow-up, if possible, with the person reporting the issue. You don't have to give them all the nitty-gritty details, but you can at least say, hey, we've looked into this, and either we're taking steps to remedy it, or we determine that there's not an issue. So that way, you address it with the person while they're still with the organization, and make them feel like, yes, I've been listened to, and the organization took this seriously, and they feel better about it. If in the example that you gave, Steve, of the next step where a report has been made by someone who is a former employee, one way to help address that and to kind of maybe try and get some shield from a liability is to conduct exit interviews of your employees and specifically ask them if they are aware of any compliance issues or violations or anything along those lines, and then document what is said during the exit interview, because that can help you. If they say, no, I don't know about anything, then that is a good, that can be a very good shield against later claims that they would try and say, hey, there are all these things. And you say, well, we asked you about it. Why didn't you tell us?
Yeah, I also think, I mean, being Captain Obvious here, but I think one reason training is so important is that if you need to terminate an employee for a HIPAA violation, you do not want them to be able to come back and say, well, I didn't know I couldn't talk to my neighbor about our other mutual neighbor about their condition when they came into the office, and unless you have provided that training and can document it, that could be, could potentially increase your liability. So.
Yeah, no, I agree. I wholeheartedly agree with you there, Steve.
Yeah.
Definitely the first line of defense against trying to prevent breaches and fines from coming into play is good education and training of your staff and everyone who's handling your information.
Right. You guys, Matt, you brought up security risk assessment. It's a favorite topic of Steve's as well. Sharon's question is, inadequate and or missing security risk assessment seems to be the most common reason to fail an audit. I'm actually not sure if that's true or not, but perhaps. What are other common causes for failing an audit?
Matt, I'll let you take that one.
Yeah, well, in terms of failing an audit, unfortunately, there's not too much data out there, since we're still relying on, for audits in particular, the information from the pilot series that happened already a few years ago at this point, and we're still waiting for the official round to begin. But as I recall from the pilot audits, the reasons for failing kind of ran the gamut. I think not having that risk analysis is a big one. But not having just adequate policies and procedures in place, not following through on what you've got. I think a good way to find, maybe not, as I said, not reasons that you fail an audit, but reasons that you can get fined, or just take a look at all the settlement announcements from OCR. I know we've mentioned a bunch of them. It's not having encrypted devices, employee snooping, so which is really improper access. One of the big ones I remember, and this ties into a lot of discussion, is not having had an actual breach notification policy. Remember, these are all things that you have to have in place. So unfortunately, it's hard to say what a common cause to fail is, since so many issues have been identified.
Yeah, and the corrective action plans from OCR tend to reflect, the specific thing that was at issue. And I will say that, that she may be asking not just about the, the random audits that are supposed to be based starting this year, but probably like audits related to meaningful use and to, OCR actions. And meaningful use, as has already been pointed out, I mean, risk analysis is, I think it's safe to say, by far the main reason people are failing their risk analysis, and it's getting better, but it's still a real issue. And so, doing the risk analysis is important. I've said it before, but just so everybody's clear, because there's been a lot of kind of uncertainty between different elements. So I'm just going to say you have to do your risk analysis by December 31st, 2015 for this year. There I could go into kind of more about, some confusion. We're going to have a Q&A article up about risk analysis in a few minutes. But in addition, Matt touched on, I think, so failing to have and to document compliance against policies is another really common one. You'll sometimes see in a corrective action plan had a policy but didn't follow it. And I will point to my monthly webinars. We do kind of two back-to-back. One's called HIPAA Security 101, and the other is called Compliance Essentials. And basically in that we really talk about what compliance is. And one of the points that I make is that a 3-ring binder on a shelf does
Right.
not make a person compliant. Now, I still say it's better than not having a 3-ring binder on a shelf, but ultimately you need to have a way to kind of bake the compliance related and policy related activities into your operations and workflow. I know that's kind of can be a little overwhelming. You want to automate what you can, but still, aside from, I'd say the 3 big ones are risk analysis, policies, and training. Those are kind of the big broad areas, and then most of the corrective action plans you read are going to get down to the specific cause of the breach.
Got one of our registrants, speaking of breaches, asked, what are your thoughts about breach insurance, carrying breach insurance?
I think it's a great idea, and there are policies available. I've heard, this is kind of informally through the grapevine, that those carriers are becoming stricter about affirming or requiring proof of compliance in compliance-related activities. I don't have verification of that, but it seems plausible given the potential size of some of the these massive breaches and what the potential payout's going to be for some of these insurers. But there's HIPAA/breach insurance policies available, and and I think they're worth looking into.
So are you talking about, perhaps if you have insurance, but if the insurance company investigated the claim and saw that there was like willful neglect or something,
Yeah, and this is maybe more Matt, because I don't know exactly what insurance companies can do and what has to be affirmed when you're buying a policy. The one thing I will say is that it is true that your typical, what is it called, errors and omission, type policies, like if you're for a clinic, and even many cases malpractice insurance will not necessarily cover this kind of event. And so you may have to talk with your insurer about getting a rider to cover this.
That's a very good point, Steve. You have to make sure, if you're not going to get a specific, like cyber liability or breach policy, it's possible that an E&O or an umbrella or a general liability might cover it, but I agree with you, Steve. You have to talk with your insurer in terms of what's included within the policy, and then also what are the conditions for coverage actually applying. I agree with you. I've also been hearing that, and I've seen at least a few stories where the insurer was challenging coverage because they said that the insured was not actually following their compliance program. To me, it's not surprising that the insurer is going to fight that, because basically they're saying, well, you told us that you had a compliance program in place, you told us you were going to take these measures, and then you ignored that, so why should we have to pay for it? So another piece to look out for is, my understanding, especially for like the cyber liability stuff, is there are extremely detailed questionnaires that the insurers are sending out to people seeking to obtain that insurance, and you have to be beyond honest when you're filling those out, because any misrepresentation in there could put your coverage into jeopardy. So it's, as Steve pointed out, the dollar amounts are climbing so quickly that, while there are policies and insurers in the market, they are being very careful in terms of when they're going to have to pay out, because otherwise it could drive the insurance company out of business. So it's, I think it is a good idea to pursue it, but also make sure you're very carefully reading the terms of whatever coverage you're obtaining, because I'm also not aware that there's any kind of industry standard in terms of how it works yet either. So it's really going to be driven a lot by which company you're working with.
Moving on, this is actually a very granular question. Is it a breach if an adult patient is comatose and the mother or next of kin or someone who is not the legal guardian gets the patient's records?
Take it away, Matt.
Yeah.
That's like right in your wheelhouse.
That is in your strike zone.
Yeah, so this is actually fallen under the privacy rule as opposed to technically the security rule. So you can disclose information to a family member, so it doesn't have to be the legal guardian. This falls into the category of where the person needs to be given the opportunity to object, which, if as laid out in the question, the patient is comatose, they clearly are not going to be able to do that. But there should be some type of reasonable expectation that the person that you're disclosing the information to has some role within the person's care.
Right.
So again, it doesn't have to be the legal guardian, but it can be a family member or a personal representative. But it's make a reasonable assessment of the circumstances and who's asking for it, and don't just be giving away the records to anybody, but use some common sense when you're approaching it.
Right. One of our listeners actually chimed in, going back to the insurance question, and chimed in. We had a rider on our policy for breaches, but the levels of coverage were less than an actual cyber liability policy.
Yeah, I would say I'm probably not surprised by that, because if you're getting a rider on some other type of coverage, they might not go up to the full coverage limits, or the coverage limits on your other type of policy might be lower than what you would seek to have on a cyber liability policy.
Right.
The other thing a couple other thoughts to keep in mind, not to extend the insurance discussion more, but some other thoughts to keep in mind are the fact that you might not be able to get coverage for government fines and penalties. It might just be something that has to fall outside of coverage. So keep an eye on that. And then especially for business associates or others, be very cognizant of what could happen if you're agreeing to an indemnification provision, which often shows up in the business associate agreement, even though it's not required to. Sometimes agreeing to do that can invalidate your coverage as well.
That's a good point, especially I suppose if somebody, a fine by HSS, versus a patient civilly taking you to civil court, basically right. Yeah. We are a substance abuse facility. Who should we report privacy violations to? The Justice Center or OCR, the Office of Civil Rights?
That is an interesting question, and so first of all, there is actually an area of law where there's sort of an interesting oversight between the department, the DEA, the Drug Enforcement Agency, and HHS, and that's related to standards for the electronic prescribing of controlled substances. The DEA actually wrote the standards that have been released and implemented related to how and when it's acceptable to do that, and but other than that, since I don't, I've just always assumed that a Justice Department actions dealing with sort of criminal activity. Matt, is that kind of a fair way to,
yeah,
assess
I guess
it? Of course, HIPAA can be criminal and civil, so.
Yeah, the department, if by the Justice Center they mean the Department of Justice, yes. The Department of Justice has both criminal and civil jurisdiction. But, kind of your point, Steve, especially when you're talking about substance abuse, you might have some overlap of differing regulations. So if you've got something that qualifies as PHI and you end up with a privacy violation, then I think that might end up have to be getting reported to OCR. If the Justice Center referred to in the question is something that's more of a state level issue, then the other thing to keep in mind is be cognizant of what your individual state where you're located might require in terms of reporting for different types of violations. because you always have to remember HIPAA sets the floor in terms of what has to be done, and then the states can always impose more restrictive requirements on top of that. And substance abuse is a good example there, because in Massachusetts, where I'm located, we have some specific privacy protections around substance abuse or behavioral health, and some other types of records that are impose more privacy restrictions than would just fall under the HIPAA ambit.
And that's even true within HIPAA itself, is that you require written authorization for the release of certain behavioral health records, or maybe all behavioral health records. So HIPAA kind of acknowledges a special category for behavioral health information.
So moving on, we've got a question from our somebody on the broadcast right now. Steve, you mentioned Dropbox at the very start of the program, and we get this question probably every single month. We do have a chat, which is, can you recommend HIPAA compliant alternative to Dropbox?
Yes, and I would, before I answer, I would recommend that when that Q&A goes up sometime in the next week, keep an eye out for it, because it's going to kind of go into a little bit of the nuances. But they're proliferating. There are actually quite a few of them. Box.com, I would say, is the market leader. They were the first one to kind of boldly proclaim their HIPAA compliance and that they were willing to sign a business associates agreement. Mm-hmm. Yeah. Then Citrix has a solution called ShareFile that's out. Even Google will now sign a business associates agreement. You can use Google Drive. My only concern about Google is that it does not have it's actually less expensive, so that's the good news about it. And it does not, now here, if you're hear me, folks, what I'm about to say, it's very important. What I'm saying about Google does not apply to personal Google accounts like your Steve Spearman at gmail.com or Matt Fisher. It's only for enterprise accounts. So and then once you've got that set up, you go in through this process of signing a digital business associates agreement, and it is less expensive than a lot of the more some of the other systems. But I will say Box.com has a feature set that I really, really like, and I think some of the others are developing that is very consistent with the goals, so related to auditing, and auditing activities, etc. So there are a number of them out there, and I'm always kind of I'm thinking about actually publishing sort of a list with sort of the pros and cons of various ones, but those are three big ones that really have kind of thrust themselves very boldly into the market. Box, ShareFile, which is a Citrix company, and then I would put Google in the mix. Now, Microsoft SkyDrive, or now I think they call it OneDrive. Microsoft is willing to sign a business associates agreement, and then so yeah, that's kind of a quick list.
And I think this next question, I think, is different than the Dropbox question, which is, or maybe not. I'm not quite sure. But from the audience today, are any of the free encryption softwares that you see out there in the marketplace offered adequate for a small medical clinic?
I can't answer that because I'm not aware of any. I'm not aware of any anymore. There used to be an open source encryption solution called TrueCrypt that was very good and was free, but they are no longer, the guys that were running that open source project kind of left the project, and they pointed people to BitLocker. I don't know why they pointed people to BitLocker. My quick answer to that, so I don't know if the user is listening and can type in what the tool is that they're using and help me get a little more specific. But being free versus being paid for is in and of itself not a criteria by which we can judge whether something's acceptable. So But I'm not aware of any free/open source solutions that I would recommend, at least as of today. So if the user wants to kind of put in what it is, and let Carol relay that, we can possibly address that. I do want to add that when it comes to encryption, that it's not just the ability to kind of encrypt the data that's important, but there are a number of issues that come up when you're encrypting, including what's called key management. So, when you encrypt devices, you have to have, secure passwords in order to encrypt, decrypt the data. That's in fact in the standards. The reason that encryption is under the access control standard, it's a safeguard under the access control standard, is because without access control, that is at least a username and password, you can't encrypt. And so for some organizations, one of the things I would talk about with TrueCrypt before they went away was that even though the quality of encryption was good, a lot of people would not adequately address the issue of key management and password resets and things like that, and how that affects, your support capabilities. So, anyway, if the listener wants to kind of let us know which system that is, I might be able to talk a little bit more about that.
Right, right.
I think I just chime in to say that Steve's point about the key management is you remember encryption, it doesn't operate in a vacuum by itself. It's part of the larger security policies that you're putting into place, so it does interact with a bunch of the other elements. And I also agree with Steve, it doesn't matter how much or how little a solution costs, but you want to kind of do your diligence about it and ask questions to see how it actually operates, and what other users' experiences might be with it if you can't get any direct answers from the developer in terms of what has been built into it, so you can be able to do an assessment.
Yes, if somebody from the audience chimed in, going back to Dropbox, I was a few minutes late. Can you summarize again what the issues are with Dropbox? We currently use it, and if we need to change, we want to do it soon.
Yeah, do it yesterday.
Do it yesterday,
the
right.
issue is actually both technical and procedural, regulatory. They will not sign a business associates agreement. That's the main thing. You cannot, a vendor that is accessing, processing, managing, transmitting, storing protected health information is by definition a business associate. And they're a business associate even if you don't have a business associates agreement in place with them, and it's just that not having one in place actually increases your liability. So
also, not having the BA in place is a violation by the covered entity, since it is an obligation of the covered entity to get a business associate agreement signed.
Mm-hmm.
Exactly. So Dropbox won't sign one. They're also the reason, I think one of the reasons they won't sign one is that they are that it has to do with technical. This is a little bit like tech talk, but the headers are not encrypted. It's sort of like being able to see the metadata in files. And by the way, I do want to warn, there are companies out there making the claim that they can make Dropbox compliant. If you go and make my Dropbox HIPAA compliant, don't do it though, because they can't do it. They're just saying we're going to be giving an ability to do adequate encryption, but the data is still being stored by Dropbox. You can't use them. So yes, move quickly and find something that's adequate. And I do want to warn you that once you go to these HIPAA compliant systems, they're not as slick as Dropbox. It's for a number of reasons, but it'll give you a good capability that will be HIPAA compliant, and any of those other vendors would work.
And as another reason for the quick summary of why you want to move away, as Steve said, as quickly as you can, is the St. Elizabeth settlement that we were talking about, which was specifically said came out of using a non-HIPAA or a file sharing service that does not comply with HIPAA standards.
Yeah, and I don't know about you, Matt, but I've not heard that it was Dropbox, but it's like, yeah, it was Dropbox. That's what everybody uses. I mean, so just to be clear, I have not been able to independently confirm that it was Dropbox, but it's like, I can't imagine it was anybody but Dropbox. That's what everybody uses and wants to use. So.
Yeah, and regardless of whether it was Dropbox or not, it's clear that whatever was described matches the description of how Dropbox operates. So, by proxy, it shows you why it's a good idea to move away from there.
Yeah, yeah.
Right. So getting back to small practice question, wanting to know, what would be the one or two things you would recommend that they do to ensure that they are in compliance?
I'm going to sort of take that on and then let Matt finish it out. Like, I'll tee it up and let him hit it out of the park. But I mean, as we've already said, policies, risk analysis, policies, and training. Those are my three big ones. You need to understand what your risks are for the requirement of risk analysis. You need to train your employees on what the regulations required and what your policies required. And you need to make sure you have those policies with a proper, what I call policy map, which means that you have a policy that addresses the regulations. And of course we do with my risk analysis service, we include a complete set of policies as well as a policy map. And then we're actually going to be looking at starting to do some training here pretty soon too. But Matt, you want to is that a pretty good threesome or?
Yeah, no, I think those are some of the three fundamental components, and probably the only thing I would add is kind of words of wisdom that I like to throw out there, that compliance of any kind has to be a living, breathing thing. It cannot be static, but it has to be continually evolving. I've worked with a few practices recently that haven't updated policies for like 5 or 6 years, which is obviously misses all the omnibus changes, but you shouldn't wait for major changes in the regulations, because as we were talking about earlier, the threats and the weaknesses are continually changing. So you need to keep on top of all those. You need to make sure that you're responding to the changing nature of your organization too. So there's a lot of moving pieces that need to be that you need to keep on top of, and it really does require constant vigilance. And if you ever feel like, yeah, I've got this, and I feel like I'm pretty good, you're in trouble.
Right. The minute you feel that, it's probably antiquated based on how fast.
That's when the other shoe drops, so to speak.
Yeah. So, believe it or not, we're just about out of time. I want to remind people that if you have a question for Steve or for Matt, please email them. It's spearman@healthsecuritysolutions.com and mfisher@muricO'Connell.com. Please check out our HIPAA Chat group on LinkedIn. If you go to LinkedIn and search for HIPAA Chat or HIPAA, it'll pop up there. I'm active in it. Steve, of course, is active in it, as is Matt. And keep an eye on HITECH Answers, where Matt is a regular guest contributor of ours, and we will be doing our series of Q&A blog posts with Steve. So we're pretty excited about that. Gentlemen,
hey, Carol,
yeah.
I think we got, real quick, I'll say, let's see, we're going to be doing a BYOD show, don't we, in the next couple of months? Yeah.
Oh, thank you. That one of our listeners said this was absolutely awesome. Thank you. Well, thank you. We are next September. We are BYOD. It's it's a huge issue.
Yeah. How do you manage personally owned devices? And then I have just recently did some work with a very large enterprise, and hope to be doing a show about the security officer role specifically, which I'm pretty excited about, as well as a show on medical devices. So anyway, it'll be fun, and then of course we have to have Matt back on very, very soon.
I think so. I
don't think you're an official regular, Matt, until it's your third go.
Well, I definitely appreciate the invitation, and I'm always happy to join. It's always a very fun discussion. There's so many things to talk about that and to see the interaction from the audience is great too.
Yeah,
I always like to be able to talk about what's interesting people as opposed to what's interesting me.
We're great words of advice, and with that, we'll make this a wrap. Thank you to our audience. Thank you, Matt. Thank you, Steve, of course. We'll see you next month on HIPAA Chat. Hope everybody has a great weekend.